thank you for coming by the Atlanta Voice today. We appreciate you coming. So tell the people who you are, where you came from, where did you go to school, and all that good stuff.
Oh, wonderful. Oh, wow. Thank you so much for having me here this afternoon. I'm so grateful to be here. I am Janice Laws Robinson. I am running to be Georgia's next insurance commissioner. And I grew up in Jamaica. In my early childhood, I lived in New York for a while, and I've been a proud Georgian now for more than 2 decades. And so I consider myself a Georgia peach and love living here. I love everything about our beautiful state, and I'm happy to be in a position to serve all Georgians. I am a mom. I have 2 beautiful daughters. My oldest daughter serves in the United States Navy. My youngest daughter is a student, and I am married. My husband and I are small business owners, and I've been a licensed insurance professional for more than 2 decades, working with Georgia families, serving them with their insurance needs. I'm grateful to be here to have this conversation with you.
Good deal, and we're glad to have you. So you're running for the office of Georgia Insurance Commissioner.
Yes.
Tell us why you wanted to run. Tell us what inspired you to run for it.
Yes, as I said, I've been a licensed insurance professional for more than 2 decades, and work with Georgia families. And I've seen the struggles everyday Georgians deal with when it comes to their insurance needs. In fact, I ran in 2018, was my first time running for this office, because my clients kept complaining to me regarding the rate hikes that we're facing in Georgia. Every 6 months, seeing their auto and their home insurance rates go through the roof. They wanted me to do something about it. And I got very clear that there was nothing I could do as an agent, because by the time rates got to the agency level, it was already done. So I knew that I had to step up and make change happen at the state level. And so that is why I'm running. I'm running because Georgians deserve an insurance commissioner that will fight the outrageous auto insurance rates that we're facing, the skyrocketing home insurance rates, the lack of access to quality, affordable insurance, and to hold insurance companies accountable. And that's what I'm committed to.
Absolutely. Speaking of high insurance and high insurance rates and the accessibility to insurance, tell us about your platform. We saw on your website as we did our research that you emphasize the 3 A's.
Yes. So my 3 A's are affordability, access, and accountability. So affordability, again, comes back to the rates. Georgia has some of the highest auto insurance rates in the country, and we do not have an insurance commissioner that is fighting those rates. And the job of the insurance commissioner is to look out for us as Georgians, to be the watchdog, to be our consumer advocate, and to challenge these rates and push back on these rates. And that has not been done. And that will be my first priority, will be to challenge insurance rates to make sure that we have affordable rates. And number 2, to make sure that we have access to quality, affordable insurance across the board, especially health insurance. We know that over 1.4 million Georgians currently do not have access to quality, affordable health insurance. And though that doesn't all rest with the insurance commissioner, I think it's a top priority as insurance commissioner to be part of that fight, to make sure that every single Georgian has access to affordable health insurance, and that will be a top priority for me. And the other A of accountability is when everyday families, when you pay your insurance premium, you're paying for a promise. You're paying for the promise that insurance companies will take care of your claim when you have an accident, in an unforeseen or unfortunate circumstance, whether it's a car accident, whether it's a health issue, whether it's a home loss due to weather or fire, anything of that nature. And the insurance companies need to do the right thing. And I've seen time after time where so many people just struggle to get their claims paid. And that's the problem. I've seen in my own community, last year we had a tornado and people were waiting for almost a year to get these claims resolved, and that's unacceptable. So as insurance commissioner, I will absolutely hold insurance companies accountable. I will make sure that we have a hotline that people can call in, not just have to dig through the website to see how to even file a claim. In fact, most people don't even know there's an insurance commissioner or that there's an insurance commissioner's office. So part of my campaign has been educating and informing people across the state that there is an insurance commissioner. The job of the insurance commissioner is to be our advocate and to hold insurance companies accountable, and that's what I'll do, because Georgians are tired. We're tired of insurance companies using us for a piggy bank and not doing the right thing when it comes to taking care of us. So
this is a question that, you know, that's based on current events. As we know, Atlanta Medical Center is on the verge of shutting down effective November 1st, and on October 14th, they're going to shut their emergency room. In what ways would your office, I know Stacey Abrams has talked about expansion of Medicaid, in what ways and how could the insurance commissioner, how does that role piggyback or complement the claims for Stacey Abrams to increase Medicaid and healthcare and insurance access? And if so being, if all that is true, would it save AMC?
Well, great question. I think expanding Medicaid would be absolutely a great service to Georgians. Just by expanding Medicaid, we can insure over 500,000 Georgians. And what you gotta realize is, even though people view Medicaid expansion as something for people that are in need, we got to look at the bigger picture. And whether you need Medicaid expansion or not, it impacts you. Because in Georgia, if you do not have insurance, you go to the emergency room, you still have to be cared for. And so that ends up being paid by the taxpayer. And if you live in a well-to-do neighborhood, or whether you live in a poor neighborhood, it still impacts you, because we have hospitals closing because they cannot afford to stay afloat, because there's just not sufficient money's coming in because too many people are uninsured. So it impacts you whether you have regular insurance or whether you have Medicaid. So this is a big issue and it needs to be addressed. So I support Medicaid expansion. I think that it is time that we address this issue. I will be working alongside Leader Abrams and other folks to ensure that, yes, we do expand Medicaid, because it's critical. But also, that's when I talk about access, that's a big part of it, but also just making sure that we have affordable insurance across the board for everyone. And we have access to more insurance companies on the marketplace, so that there are options and people are able to obtain the insurance, the quality insurance, but also at the affordable rates that they need, because this impacts hospital closings, it impacts our health and well-being, it impacts whether we go to the hospital or not. So it's bigger than just one single issue. But I think expanding Medicaid would be one of the single biggest things that we could do that will make the largest impact.
What are the issues we just saw last week with Hurricane Ian coming and upsetting and altering the lives of many Floridians. Last week, you know, we also have hurricanes that do come to Georgia every now and again. How does my question is, how would you position your office to better serve those needs of people who live on our coastline, who live near the ports and Tybee Island and other places that are or could be impacted by these devastating storms?
As insurance commissioner, one of my plans will be definitely to work with GMA and FEMA to make sure that resources are allocated to all communities that need the resources, but also to, again, hold insurance companies accountable. Because one of the major issues that families have is not being taken care of when we have claims. And also the other issue is when we do have claims with these catastrophic incidents, insurance companies cancel your policies or non-renew your policies or choose not to insure. So those are all factors that the insurance commissioner can impact. And I will ensure that, number one, we put a moratorium on cancellations. So if you've been impacted by a weather-related incident such as a hurricane or a tornado, insurance companies cannot just cancel you because you've had that, because that's the reason why you have insurance. And so this is what I mean by accountability. So just accountability and ensuring that I work with all other departments to make sure resources are properly allocated, I think would be a great start.
Mm-hmm. One of the major issues we see, especially in the city of Atlanta, is just insurance fraud. Mm-hmm. How would you combat that if elected?
Yes, so when I'm elected as insurance commissioner, I will make sure that we're investigating these issues and working with the proper departments to, one, make sure these people are fined, get the appropriate penalties, because we do know that we have a problem with rates. And even though I know that insurance companies are unfairly charging and overcharging, I do think that fraud impacts the rates as well. And so we have to attack all of these areas that are impacting rates in Georgia, and I think that is one of the areas that does impact rates, and it's time that we deal with these incidents.
We reported back in April, late March, early April, about John King and he slapping the $5 million fine on Anthem and Blue Cross Blue Shield of Georgia because they did not process claims in a timely manner, and people were left unpaid or people were left in the lurch because of their issues. As insurance commissioner, would you, for lack of a better term, tighten the grip on healthcare companies that may or may not be doing the right thing, or would you examine their practices with a finer tooth comb? What would you say?
Absolutely. I think all of these insurance companies should be investigated and examined, not just on the health care side, but across the board. And, you know, I think accountability is key. And if insurance companies or just people in general are not held accountable, it doesn't work. And so I think insurance companies have a duty to insureds and to policyholders to do the right thing. And when they don't, they should be held accountable. And I will do just that.
This is my last question, and I'd love to thank you again for stopping by. It is an honor and privilege to have you here today. How can people get in touch with you? Because I am sure, they have a lot of questions.
Yes.
I have a lot of questions,
Yes.
but Due to time constraints, I can't get to all of them. But how can people get in touch with you with whatever issues or questions or concerns that they may have?
Yes. Anyone that would like to reach our campaign can email questions to info@janiceforgeorgia.com. You can visit our website at janiceforgeorgia.com, and also just follow us on social media at Janice for Georgia. That's across all social media platforms. And I would love to hear from everyone that has questions, because this is a conversation for all of us. I am taking this on as a public service because I do want to serve everyday Georgians. I'm committed to serving all of Georgia, whether you're urban, suburban, or rural. I want to make sure you know your voices are heard and that you have a seat at the table, and that I will be your insurance commissioner.
Good deal. Thank you so much.
Thank you for having me.
Mm-hmm.